Millions of people take omeprazole every single day. Some have been on it for months, others for years, and most believe it is completely safe. But what if the real danger does not start on day one? What if it begins slowly, after long-term use, quietly, without clear warning signs? In this video, we will talk about 7 hidden dangers of long-term omeprazole use. Things most people are never told. Not to scare you, but to help you make informed choices. Omeprazole works by lowering stomach acid. Less acid means less burning and less pain. That is why people feel relief quickly. But here is the key point. Omeprazole does not fix the root cause of the problem. It does not heal weak valves, poor digestion, or lifestyle triggers. Instead, it changes how your stomach normally functions. It keeps acid levels low for long periods of time. M2, and that change can affect the body in ways most people never expect. Long-term use of omeprazole is very common for one simple reason. It works fast. People feel better, so they keep taking it. Over time, prescriptions are often renewed again and again, sometimes without a full review. Not because doctors are careless, but because the medicine seems to help. The problem is that many patients are never clearly told when to stop, or that omeprazole was meant for short-term use in many cases. So what starts as temporary relief slowly turns into a long-term habit. Your stomach acid does more than cause heartburn. It plays a key role in helping your body absorb vitamin B12. When omeprazole lowers acid for a long time, that process slowly breaks down. At first, nothing feels wrong. But months later, subtle signs can appear. Constant tiredness, tingling in the hands or feet, poor memory, trouble focusing. Many people blame stress or aging. Some are even told it's anxiety or depression. But the real cause may be low vitamin B12. And because the symptoms develop slowly, they are easy to miss. This is why B12 deficiency linked to long-term omeprazole use often goes undiagnosed. By the time it's discovered, nerve damage may already have started. And some nerve damage can be permanent. The scary part is not the deficiency itself. It's how quietly it happens. Danger number 2. Magnesium and calcium loss. Stomach acid helps your body absorb important minerals. 2 of the most critical ones are magnesium and calcium. When acid stays low for too long, absorption drops. Slowly, silently. Magnesium deficiency can cause muscle cramps, weakness, and abnormal heart rhythms. Calcium loss affects bone strength. Over time, bones become thinner and more fragile. This matters even more as people age. Older adults already lose bone density naturally. Long-term omeprazole use can speed that process up. The result is a higher risk of fractures, especially hip and spine fractures. Many people don't connect a broken bone to a stomach medicine. But research shows the link is real. The danger isn't immediate pain. It's long-term weakness that builds quietly, year after year. Danger number 3. Increased infection risk. Stomach acid is one of your body's natural defense systems. It kills harmful bacteria before they reach your gut. When acid is suppressed, that protection weakens. With low acid, germs that should die can survive. Some move into the intestines. Others reach the lungs. This increases the risk of gut infections and even pneumonia. One example is a bacteria called C. diff. It can cause severe diarrhea and life-threatening complications. Long-term omeprazole use has been linked to a higher risk of this infection. Most people never expect a reflux medicine to affect immunity. But your stomach is part of your immune system. When its balance is disturbed, the entire body feels the impact. And the risk increases the longer the medication is used. Danger number 4. Kidney damage. Kidney damage linked to omeprazole doesn't happen overnight. That's what makes it dangerous. It develops slowly, often without pain. Studies have linked long-term use to chronic kidney disease. In many cases, people feel completely normal at first. No warning signs, no symptoms. By the time problems appear, damage may already be advanced, and kidney damage is often irreversible. What makes this even more concerning is that routine blood tests are not always done, so changes can go unnoticed for years. People continue taking the medicine, unaware that their kidneys are under stress. This is not common knowledge, but it is serious, and it deserves attention. Danger number 5. Rebound. Acid hypersecretion. Many people try to stop omeprazole suddenly. That's when trouble begins. When the drug is stopped, the stomach can overproduce acid, more than before. Symptoms come back stronger, more burning, more pain. This rebound effect makes people believe they still need the drug, so they restart it, and the cycle continues. This is how short-term use turns into lifelong dependence. Not because the disease got worse, but because the body adapted to the medication. Without proper tapering and guidance, stopping becomes harder than starting. This is one of the biggest traps of long-term omeprazole use. Danger number 6. Gut microbiome imbalance. Your gut contains trillions of bacteria. Good bacteria, bad bacteria. Balance matters. Long-term acid suppression changes that balance. Some bacteria grow too much. Others disappear. This can lead to bloating, gas, constipation, or diarrhea. But the effects go deeper. The gut microbiome influences immunity, metabolism, and even mood. When it's disrupted, the whole body feels off. People may develop food sensitivities, or feel chronically unwell without knowing why. Again, the change is slow, quiet, easy to ignore, until symptoms become hard to manage. Danger number 7. Masking serious conditions. Omeprazole is very good at hiding symptoms. Pain goes away. Burning stops. But symptoms disappearing does not mean the problem is gone. Ulcers, bleeding, even stomach cancer can be masked. This delays diagnosis, and delayed diagnosis can be dangerous. Relief feels reassuring, but relief is not the same as safety. When symptoms are hidden for years, serious disease can progress unnoticed. That is one of the most overlooked risks of long-term use. Some people face higher risks than others. Elderly patients are one group. Their bodies process drugs differently. People who have taken omeprazole for years should also be cautious, especially without regular medical review. And those using it without a clear diagnosis or follow-up need to be careful. Long-term use should never be automatic. Never stop omeprazole suddenly. Doing so can make symptoms worse. Always talk to a healthcare professional before changing your dose. Awareness is not fear. It is protection. The goal is smart use, not panic. Omeprazole can be helpful, but it is not harmless. Long-term use deserves careful attention. Ask questions. Review your need regularly. And if this video helped you, share it with someone who takes omeprazole.